coming and joining us today as we outline the legislative budget and budget priorities of the Rhode Island Coalition for Children and Families. I'm Tanya Kubasmeyer, Executive Director. Our growing membership includes 40 agencies that provide direct services to children, youth, and families, as well as 3 allied advocacy organizations. As part of our strategic planning, we have made a deep commitment to anti-racism and race equity, to inclusion and belonging of all our children, youth, and families. We are proud that our priorities reflect these commitments. Nicholas Kristof of the New York Times recently wrote and called upon our nation's leaders and political leaders to do better by our children, reminding us that children are more likely to go hungry or to live in poverty in America than in the rest of our peer countries. And they are also more likely to die young because of drugs, guns, accidents, and an inequitable healthcare system. The children, youth, and families that our members serve are at the highest risk and provide and present the greatest opportunity for our state. We are committed to a system that meets the needs that children and their families present, not one limited by current budgets. We lead on some issues and we support campaigns on others, whether childcare, school meals, gun control, etc. It is hard to prioritize among so many concerns, but the issues we will discuss today are core to the safety and well-being of our children, youth, and families. We are so pleased to be joined today at our legislative briefing by leaders, K. Joseph Shekarchi, Speaker of the House, and Majority Leader of the Senate, Ryan Pearson, and Lieutenant Governor Matos will be joining us in a few minutes as well. I want to recognize, and yes, I have my list, Rep. Handy, Rep. Casimiro, I see Rep. Spears, Rep. Tanzi, Rep. Boylan, Senator, I'm sorry, who am I missing? We will keep going as we find out who's here. Thank you. So without further ado, Speaker Shekarchi, may I welcome you to the podium.
Thank you. Thank you, Tanya. Thank you for what you do, and thank everyone in this room, the advocates, for all you do. It's not easy to advocate for any cause today because there's so many of them, and there's so much competition for very limited resources, but you do a phenomenal job. Your organization does a phenomenal job, and you have a lot of advocates in the House. I want to recognize my colleague and friend from the Senate, Senate Majority Leader, Ryan Pearson. I'll leave it to him to recognize his colleagues in the Senate, but you recognize mine already, so I don't have to do that. I want to thank everybody for being here today, but more importantly, as I said, for the work you've been doing for so long. So many people in so many different areas. You said you have a coalition of 40. I will tell you, almost all of the 40 come and see me individually, all asking for funds, and I appreciate that. Unfortunately, most of them are asking for funds that are not in the budget, but that's part of the process, and we welcome that advocacy. That is critically important today. You'll be hearing from some of the general officers and leading advocates in the General Assembly with youth and families, including my colleague Teresa Tanzi and others. All of us in the General Assembly appreciate your work and your input. In fact, last year the General Assembly amended its 24 fiscal year budget after feedback it received from you. We added, if you remember, $7 million for early childhood programs from unspent federal funds. $3 million to preserve Head Start and early Head Start seats, an additional $4 million for a pilot program to expand eligibility for child care workers to have free child care. As many of you know, one of my top priorities since I became Speaker is to addressing the Rhode Island housing homelessness crisis. All positive outcomes start with a good, safe home. Sadly, many of our Rhode Island children do not have that good, safe home that most of us, if not all of us in this room, have had. Children do better in school, adults do better prepared for their jobs, families' physical and mental health is better when they have stable living quarters. Everyone deserves a safe place to live that they can afford. It's a matter of equity. For the past 3 years, the House has been working on this issue with our partners in the Senate. The General Assembly passed a 13-bill package for housing legislation in 2023. This is in addition to the 17 bills introduced and passed the previous 2 sessions. I will be announcing another housing package next week. And I'm going to keep working with my colleagues in the General Assembly to make more housing affordable and accessible to all Rhode Islanders. This is not going to be an easy or quick fix. And this year's budget is going to be more challenging than the past few years. We are still dealing with a serious labor shortage in key areas. Consumers are still feeling the pinch of inflation, and the influx of new federal pandemic relief has gone. It has been exhausted. There is no more CARES Act money, there is no more ARPA money, and there's no more infrastructure money. All of us must learn to live within the means that we have. I want to thank you all for your advocacy. It's all about delivering results, and you deliver them every day. Oh, excuse me. Many times people ask, Speaker, this is a great program, can you fund it? And I would love to say yes to every one of them, because every one of those programs, every one of these programs deserve funding. And I would love to do that. And they asked me, well, can we add this to the budget? I will tell you sincerely and honestly and humbly that I have over $1 billion of asks that are not in the budget. And people say, well, can you put mine in? Can we find this $2 million, $3 million, $10 million, $20 million, $30 million, $200 million ask? And the judiciary asked for $380 million. And I say to them, it all depends on how the revenue numbers shake out in May, if we have any extra revenue numbers. But I will tell you, last year, which was unusual, we had some additional federal money that was not spent. Where did we deploy it? We deploy it right for the advocacy of people in this group, right because of the advocacy from representatives in my chamber like Tina Spears and Julie Casimiro and Jen Boylan and Teresa Tanzi, who wanted to be spent on early childhood development, daycare, and early childhood programs. So you can see where our priority is. We work with our colleagues in the Senate who have their priorities, whether it's English as a second language, whether it's more daycare and more slots for daycare, all-day daycare and pre-K. We do our best. But we have to live within our means. We're going to continue to do that. But you are a priority. You will remain a priority because of your advocacy. So I ask you to please continue that advocacy. It's important, and we listen. We hear what you're saying, and we listen to you very much. Thank you very much. Thank you.
Well, I'm pleased to say that actually 3 of the 4 items we're talking about today are in the budget, perhaps just not at the numbers we would like. So pleased to have Majority Leader Pearson here today to represent the Senate. Call you to the podium.
Thank you, and good afternoon, everybody. I'm honored to be here today to represent the Senate, and I'm going to move this so I don't make that move. I'm honored to be here today to represent the Senate, and I just want to say this coalition and how important it is to really bring together, as the Speaker mentioned, so many diverse perspectives, but to make sure that holistically we are working to improve the lives of children and families here in Rhode Island. And I know my colleagues and I are very thankful for the work that you do, not only to get us information, but to bring people here, to make the stories real. That is what we rely on to get things done. And I want to particularly recognize Senator Casado, who's here with us today, and for all her efforts on these issues over the years. Together, we've worked on many issues. We worked on Senate President Ruggiero's lead pipe initiative. We were able to secure funding and a commitment to replace lead pipes in Rhode Island. And we also worked, there's a series of senators and a coalition of senators working on many bills to end childhood lead poisoning. Chairwoman Oyer, Whip Lawson, Senator Mack, Senator Acosta, all sponsored and worked hard on some of those pieces of legislation. Also last year, we were able to work together on Senator Murray's legislation to eliminate rental application fees. Senator Miller has consistently fought over and over and over again to codify more and more pieces of the ACA into Rhode Island law, which we know is so important as Washington continues to be more and more unpredictable. And I also have to recognize President Pro Tempore Gallo, who has long been an advocate and a champion for education broadly, but especially early childhood education. Her efforts have pushed the envelope. Every year that I've been here, she's been pushing for some expansion in either childcare or kindergarten, and those are the efforts she continues, and she has had Senator Cano and Senator Mario at her side in recent years, continuing to push for some of those key initiatives. And so we have a great history of working together, and we look forward to what's to come in the future. And one of the things that we're particularly important and proud about this year is Whip Lawson's expansion of TCI coverage. I remember when we did the first TCI legislation, it was Senator Golden's legislation at the time. It was probably my first or second term, and I think hers as well. And we were a leader. We were one of only a few states. I think only California, maybe New Jersey were ahead of us at the time. We were a leader in adopting TCI, and it's so good to see temporary care insurance really expand across the country, but Rhode Island has fallen back a little bit, and it's time for us to get back into a leadership position and provide a benefit that I know probably many in this room have been able to take advantage as you work to care for loved ones in your family. Healthcare is also going to be a significant focus for the Senate this year. In likely next week, we intend in the Senate to roll out a healthcare package, one that we know will not solve every issue in healthcare. It is far too big and far too complicated of an issue, but it's one that impacts every Rhode Islander and one that we are looking forward to keep moving the conversation forward. We've made incredible investments. We need to continue those, and we also need to continue bolstering our workforce and making sure that we have providers available so that Rhode Islanders can get the care that they need. And so we're looking forward to these initiatives. We also look forward to continuing to work on education. Multilingual learners, as the speaker mentioned, has long been a priority of the Senate, priority for Senator Quesada, priority for Senator Cano, myself, Senator Costa, and others. We have to get this right. And the kids that we don't serve and the kids that we leave behind, they can't wait a year. They can't wait 2 years. Those years are really, really important. And so we're going to continue to fight for that. We're going to continue to make sure that we're getting into every district, into every community, and making sure every child has the education they need to be successful here in the state of Rhode Island. And so those are some of the highlights that we're looking forward to this year, but I know we will have many more. And I know that you will bring your view and your perspective to us. And we really, really appreciate that. And I just want to thank you in advance for all your advocacy throughout the remainder of the session. I want to thank all my colleagues in government that are here for being strong partners with us, and we look forward to continuing this agenda. Thank you, everybody.
Thank you very much, Speaker Shekarchi and Leader Pearson. We are so thankful for your remarks and everything you do for kids and families in this state. I'm so pleased to be with you all today. I'm Darlene Allen. I'm the CEO and Executive Director of Adoption Rhode Island and Chair of the Rhode Island Coalition for Children and Families. As a child welfare advocate, I worry about our children every day. Today, we will talk about solutions to 4 key challenges facing our state's children, youth, and families. 1, the need for sufficient family income. 2, the need for safety and supports to preserve families and enhance the well-being of children. 3, the need to address mental health and substance abuse challenges. And 4, the need to keep youth and families housed through prevention, shelter, and permanent solutions. Our advocacy is rooted in the belief that every child, youth, and family, regardless of their neighborhood or their community, has a right to be successful and thriving. We also understand that the path to well-being is unique for each child and family. That's why we advocate for solutions that prioritize access and equity for all. We work to embrace and include those who are often excluded and work to remedy the disparities in our systems that persist. Every child, youth, and family must be able to access the support they need. Well, I don't have time to go into the many areas that I'm not sure if Senator Cano is here yet. You cover, okay. So I still don't have enough time to say all the wonderful things about Rep. Tanzi. And I think as the speaker said, we're just so appreciative of you because you have such a history of helping our kids and families in this state. So we're like really over the moon that you're here with us today and that you're working on our proposal for a child tax credit for Rhode Island families. So it's my honor to welcome you up to the podium, Rep. Tanzi.
Good afternoon, everyone, and I am thrilled to be here. I'm thrilled to work in partnership with so many of you to address the issues that are facing our state. And this was brought to me by the coalition, and I'm so thrilled to be a part of this program advocating for a child tax credit. According to Rhode Island's Kids Count in 2021, 15%, or some 30,000 children, lived in poverty here in Rhode Island. That year, as the economy reeled from the pandemic, the federal government initiated a one-year expansion of the federal child tax credit. This increase led to an historic national 46% decline in the child poverty rate. 46% decline. Just as quickly as our country began to show progress, the credit expired, causing the rate of child poverty to skyrocket in 2022. 14 states, including Massachusetts, have child tax credits, with more proposals in state legislatures, including Connecticut. Research shows that the child tax credit directly contributes to the financial stability of families, positively impacts children's well-being, and reduces child maltreatment. Increasing families' income has a ripple effect on local economies as families gain more financial flexibility. Providing income to help our families immediately is an important goal after years of stress due to high poverty rates, the pandemic, and inflation. This proposal would provide an annual credit of $1,000 per dependent child up to the age of 18. For single-headed households, the credit would be available for those households with incomes up to $100,000, and for two-parent households earning up to $150,000. In our proposal, the credit would be refundable, so that families whose income is below the threshold to pay taxes could also benefit from this credit. According to research by the Institute on Taxation and Economic Policy, a combination of existing federal child tax credit and a state tax credit could slash child poverty rates. Rhode Island has the opportunity to join Massachusetts in this important policy choice. So we are pleased, Senator Cano and I are both pleased to join with the Rhode Island Coalition for Children and Families and the Economic Progress Institute in proposing the establishment of a child tax credit for Rhode Island families. Thank you.
Thank you so much. We also want to thank Wiona Nelson Davies and Nina Harrison and your staff for the partnership. Now I am pleased to introduce Rhode Island Coalition for Children and Families Vice Chair and Executive Director of Turning the Corner Residential Treatment Programs. She will discuss the safety and well-being of children and families. Lori Smalls.
Good afternoon, everyone. My name is Lori Smalls. Again, thank you for this opportunity to be here. The Rhode Island Department of Children, Youth, and Families has a very broad mission of child protection, education, out-of-home placement, community supports, services for children, children's behavioral health, all youth development, and juvenile justice services. This includes children who come into care in agencies such as mine who have to be placed out of home. They often come into our care having parents who have their own addictions, their own traumas, and their own behavioral health crisis. The department today is serving children, youth, and families with ever more serious needs due to substance use disorders, other addictions, mental health challenges, homelessness, and escalating community and gun violence. The social service workers at DCYF have the responsibility for the organization and management of all the cases, but the day-to-day services are provided by community-based agencies. And as we speak, almost all DCYF community-based services are being reprocured and contracts renegotiated for FY25 and forward for the next 3 to 5 years. These services are paid through a blend of state and federal dollars and do not fall under the Medicaid rate enhancements recommended by the Office of the Health Commissioner. Our members are very grateful for the legislative initiatives of the last fiscal year that helped to stabilize staff and services of the community-based providers who had not received a rate increase since 2017. Residential providers had actually received a rate reduction in 2019. However, now to go forward, we need to meet the needs of today's children, youth, and families. We need enhanced services. We need new program strategies. We need more money. Come on, somebody. It is critically, it's a critical effort on our state to have community-based services to help at the beginning of the crisis. Before things begin to escalate, families are separated and children need to be placed in residential facilities such as mine. Our facilities should be the option of the last resort after all of the efforts are made to keep families whole. That is a wonderful investment. And we cannot afford to get this wrong. We must ensure we have a robust funding to support the programs that the children, youth, and families need most. They are our most critical and vulnerable population in this state. At this point, we fear that there is a significant funding gap between the proposed budget for the department and the cost to fully fund at least $20 million of additional services. We continue to refine that number and that estimate, but we know that there is a serious gap. And without that additional funding, we will not be able to provide the enhanced services that our children, our family, and our youth so most desperately need. We appreciate your commitment to DCYF and the community providers, and we look forward to working together for the rest of the session to get this done.
Thank you, Lori. You're right, there is a real tremendous opportunity that we have in the state right now to actually make sure that we meet the needs of these kids. So appreciate all your comments. I also want to quickly highlight something very near and dear to my heart. We're so pleased and excited to support a proposed Rhode Island College free tuition program sponsored by Representative Julie Casimiro. Everyone wants to, and Senator DePalma, so very happy about that. And we just welcome Senator Cano here. Would you like to come up and say a few words? We'd love to hear from you.
Oh, perfect, thank you. Good afternoon, everyone. Buenas tardes. I'm sorry I just came out of work, but I wouldn't miss this amazing press conference. First, I'd like to say thank you to the coalition for the amazing work that you all do. We think that it is important to prioritize kids and families, and that has been a passion of mine. And today, I know Representative Tansey have addressed a bill that is dear and near to our hearts, which to support the proposal to provide the health of our families immediately need, and it is very important goal after the stress due to the high poverty rates, right? Our proposal will provide an annual tax credit of $1,000 per dependent kid up to 18 years old. Let's say that again, $1,000 per dependent child up to 18 years old. It's our proposal that the credit would be refundable so that families whose income is below the threshold to pay taxes could also benefit from the credit. According to the research, I think Representative Tansey say this is really an equity issue, and we need to make sure that we continue advancing policies that prioritize our families, especially in these times where still we see the heat of the pandemic, but also inflation and the lower wages that our working families continue to face. So we are pleased to join the Rhode Island Coalition for Children and Families and the Economic Progress Institute in proposing the establishment of the the Child Tax Credit for Rhode Island families. And I'm looking forward to seeing you all advocating for it together when we have our hearings. And it's just amazing to see all the support that you all have today for all of these policies. I just want to say once again, thank you. And on behalf of the Senate and as the Chair of Education, we just need to push together. We do this as a partner, so thank you so much to the reps that are here. I think that it's important that we continue prioritizing children and family, and let's do this. It's the year to make sure we pass this legislation, so thank you.
Thank you so much. Now, I'd like to introduce Ben Lessing Jr. He's the chair of our joint Rhode Island Coalition for Children and Families and the Substance Use and Mental Health Leadership Council's Children's Behavioral Health Committee. And he's also the president and CEO of Community Care Alliance. Ben?
Thank you, Darlene. My friend Lori Smalls softened you up. Now I'm going to deliver another message, and that message is that we are in the midst of a very serious children's behavioral health crisis. We have kids in this state right now who are experiencing trauma and depression and anxiety and serious emotional disorders. And one of the concerns that we have as a coalition is that access to resources are few and far between. We're here today to advocate for further funding for those resources. One of the things that is important for you to keep in mind is that services, community-based services in particular, are best delivered to families, with families involved, with caregivers involved, whether those are foster parents or other caregivers, guardians, and so forth. By expanding access and increasing cultural and linguistic equity in behavioral health programs and initiatives, we can ensure that every child in Rhode Island can thrive. It's especially critical that we reinvest in services to treat young people with addiction issues, as many of these services have been closed for years. Many of you may not know that addiction services for adolescents in particular have almost ceased to exist in Rhode Island over the last 6 or 7 years. Okay, that is a huge problem. The other thing that I think that is important for you to know is that what we see, particularly in community mental health organizations, is that the acuity rate, the level of seriousness that we're seeing for kids with behavioral health problems is increasing. Every day we are working with kids who are not only depressed, they're suicidal. And many of those kids have plans for how they're going to try to end their lives. And what we also see is the thing that can prevent that from happening are effective outpatient services and in particular, effective community-based intensive treatment services. Again, not enough of a framework of those services across the state. The governor's proposed budget includes funding for 3 of the legs of the stool that we need to address children's behavioral health. We're appreciative that Medicaid rates, funding of the CCBHC initiatives, and DCYF funding were included in the budget. We ask, however, that the General Assembly consider full funding of Medicaid rate increases this year, as well as provide additional resources for the DCYF procurement. One of the things I would just ask our elected officials to consider is that these are investments from a practical standpoint that save money. We have seen over the last 20 years a steady increase in kids being hospitalized, a steady increase in kids being boarded in emergency departments and so forth. All of this requires further expenditure of funds that could be more effectively utilized in community-based programs. That's what we're really talking about here. We are on the verge of being able to rebuild our state's behavioral health system to one that is excellent. Our children, youth, and families deserve no less. We really appreciate you being here today and listening to our message.
Thank you so much, Ben. Next, I'd like to introduce Lisa Gillette. She is the Executive Director of Foster Forward, and she's also the chair of our Prevent, Support, and End Homelessness for Families and Youth Committee. Lisa?
Wow, we have no shortage of things to do, but it's reassuring to look out in this room and know that we have the right champions to get it all done. Housing is no exception to the challenges that we face, and the youth and families that our members serve struggle daily with rising housing costs and unstable housing situations, often compounding the challenges that they face. Federal data shows that homelessness in Rhode Island has increased by 70% over the last 4 years. This is a growing crisis of unprecedented proportions. With average rents for a 2-bedroom apartment at over $1,700 per month, there is no solution for a mother of 2 whose only housing income is a $934 a month SSI check. In addition to the growing number of families and youth counted through our coordinated entry system, 116 families are currently being supported in hotels as families are referred to DCYF for supports and those hotel stays. The coalition urges the General Assembly to invest in solutions to homelessness beyond the emergency shelter approach. The mini conference was a positive step, but we need more. We need direct rental assistance to prevent further loss of housing. We are actually on course this year to see perhaps upwards of 10,000 new filings of eviction. We need sufficient year-round family and youth shelter placements with funding for appropriate and targeted services and supports for children and youth. And finally, we support a $150 million housing bond to ensure expansion of new affordable housing production for deeply subsidized housing opportunities for our most vulnerable children and families. Thank you.
Thank you, everyone, so much for being here. I want to recognize Representative Grace Diaz, who has joined us. Thank you for being here. If I'm not missing anyone else, if I am, please put up your hand. Iona, great to see you. Thank you so much for joining us this afternoon. Lieutenant Governor Sabina Matos had hoped to make it here and speak, and doesn't look like she's going to, but we appreciate her support during the session and always. So thank you all so much for coming. We've got a heavy agenda. We've got the Department of Children, Youth, and Families Community Services Array. We've got addressing the children's behavioral health crisis. We have preventing and ending homelessness. And we have increasing family income. It's an enormous charge, but we have to do the work as best as we can in each of these areas, stretch that budget as far as we can to provide the right initiatives, enhance current capacity, make sure it's accessible to all, and make sure our children, youth, and families are safe and can thrive and be successful. With all of your help, we can do this. Thank you. We understand that there's a housing bond conference going on downstairs, so you might want to jump down there.